we are now challenged with a very difficult and problematic variant referred to as the Delta variant. It has now been detected in at least 90-plus countries throughout the world. It has the capability of transmitting efficiently from human to human in an extraordinary manner, well beyond any of the other variants that we've experienced up to now.
Guy sounds like an expert. The Delta variant, in fact, already sending unvaccinated Americans to the hospital in alarming numbers. To make matters worse, Dr. Erwin Redlener warns us, quote, "Get ready for a fast-moving surge now. And as long as we don't share vaccines and resources with low-income countries where the virus is festering and few vaccinated, expect surge after surge for the foreseeable future. No way around this." So back with us tonight, the aforementioned Dr. Erwin Redlener, founding director of Columbia's National Center for Disaster Preparedness, who advises us on public health. He's also a professor of pediatrics at Albert Einstein College of Medicine. Doc, to put it very plainly, we have 100 million unvaccinated Americans in this country. That's a whole lot of potential damage ahead. In your view, what do the next 6 months look like, and what's the level of worry once and for all for vaccinated people in the face of this Delta variant?
Hi, Brian. Yeah, well, I'm really very concerned, as are the majority of my colleagues. One of the problems here now is that all of us who are so-called experts need to be pretty humble about predicting the future. There's more that we don't know about this Delta strain than we do know, and a lot of this is going to unfortunately remain to be seen. The facts are, though, as you started talking about, Brian, there are 100 million potential American targets who have not either had the natural disease and not been vaccinated or may not even be eligible for vaccination. And that's a big problem when we have a rapidly moving variant like this Delta. The fact is that the person who has Delta variant as their infection has 1,000 times more viral load than somebody who had one of the previous versions. So we have a lot of virus around and a lot of targets, and we're worried where this will go, how long it'll last. Will it end up being more severe in terms of hospitalizations and deaths remains to be seen. And I think we're just going to have to really follow some new rules now, Brian. That's why I'm very supportive of wearing masks indoors, whether you're vaccinated or not vaccinated. We need to avoid large, tight crowds. I hope more and more organizations and companies will mandate vaccines for employers, students, event participants, and so on. But we do have a lot to worry about, I'm so sorry to say, but I think that's the way it is right now.
And then in light of this comes the study today that the J&J one-and-done vaccine may be less effective in the face of the Delta variant. What should J&J vaccine recipients be thinking?
Well, this is obviously a new piece of research that is concerning. However, we have to temper this because these results are not peer-reviewed yet. They're not officially published, and they also are not consistent with earlier studies. What we do know about J&J is it can prevent serious hospitalizations and fatalities, even if it still allows you to get infected. We don't quite know what to do yet, and clinically, this is really a challenge for all of our physicians. If I had two patients in my office, a 30-year-old healthy person and an older person, both of whom had received the J&J vaccine, to the older person with, let's say, comorbid factors, I would say, yeah, let's give you a new another mRNA shot like Pfizer or Moderna, just to be sure. I need to be able to do that as a doctor. The younger, healthier person, we might say we're going to wait a while, but neither of those agendas is actually approved by the CDC. So a lot of clinical judgments in a very uncertain environment right now, Brian.
Doc, I got off the air last night and saw the story about Apple telling its employees, not so fast, we're going to delay at least by a month coming back to work in person. Do you expect to see this kind of thing at companies across our country?
I actually hope so. I think we're not ready to kind of open the gates right now yet, Brian. And when we do, I hope every company will actually mandate vaccines that could be proved to have been taken by employees who want to come back to the workplace. And I understand the tensions that companies are under and universities and other organizations, but we're in a very dangerous, uncertain situation right now. We have to behave like we're taking this seriously. And I think that Apple's making the correct decision right now.